So yeah, the molecule we want to talk about right now is probably one of the most popular peptides. Many of you are probably already familiar with it. It's a product called BPC 157. BPC 157 has an interesting background, and I'd love to just go into it real quickly just to sort of lay the stage. When tailor-made compounding started, generally in around 2016, this is one of the first products we rolled out, given that we'd had some great experience with it overseas in Australia for a wide variety of things, but particularly for its healing effect. So we were the first to offer it in the United States, and it absolutely took off. It's one of the most popular products. It was, you know, if anyone reads any type of biohacking books like Dave Asprey's book or even Ben Greenfield's book, it's been mentioned in this and sort of taken to a whole new level for people who are interested in biohacking and interested in sort of performance all around. A lot of the context we'll talk about it tonight is really for healing and recovery, because that's where it really seems to shine through. But we'll talk about a lot of the other implications. In order to transition just from Dr. Rice's lecture to the BPC 157, one of the really big ways the BPC 157 can take its effect is also by reducing inflammation. And so as we talk about some of these senolytic and the secretory associated senescence phenotypes, also think about BPC 157 as a way to reduce some of that inflammation that happens, and can also be sort of a product to throw in there that can also address age. I'm one of those people that believes aging is a disease, and that everyone should be taking the necessary steps to help put themselves in the best position to prevent all those age-related disease outcomes, which are all of the chronic diseases like Alzheimer's, diabetes, cardiovascular risk, and even cancer. And so I think that all of these things are great considerations for any patient that's just aging and wants to age a little bit more appropriately. So as we get to the body protection complex, or BPC 157, I also just want to stress that although we've been doing this a long time in the pharmaceutical space, unfortunately the FDA's new regulations on the bulk drug substance list has made this product unable to be compounded in compounding pharmacies. And that's going to unfortunately make it a lot less available. In an effort to provide a really great product, what we've tried to do is we've actually purchased the patent to the BPC 157. And we're really excited to announce that, because for anyone who's currently sourcing this, it'll mean that BioT and tailor-made compounding will be the only place to source this molecule. And we're actually really excited about that because we're going to be collecting a lot of great data and hope to one day take this for FDA approval for a lot of different conditions. And we'll go through a little bit about where we anticipate this having the biggest effect for your practice and your patients. Before we do, I just want to reiterate something that you all probably heard a lot before, and that is the influence of the gut on the rest of the body. For anyone who's been interested in probiotics or has patients who deal with leaky gut, any type of IBD or Crohn's, everyone knows that the sort of inflammation in the gut and the lack of endothelial integrity in the gut can cause a lot of negative effects all over the body. It can affect neurotransmitters in the brain and cause depression. It can cause malabsorption, which can affect all the rest of the body. It can do a lot of things. And so I just want to highlight the importance of this and the importance of BPC in helping fix some of these things further in this lecture. To start, the BPC 157 is a 15 amino acid peptide that was actually isolated from human gastric juice. This picture right here is a picture of Pavlov's dog experiments. A lot of people generally think of Pavlov as the guy who sort of rang a bell in order to do behavioral conditioning for animals. But beyond that, he also did a lot of collection on the physiology of animals. Here you can actually see the experiments he derived to collect the gastric secretions that are secreted when we eat by making sure that they were just collected purely from the stomach and not necessarily contaminated with the food ingredients. And this type of evaluation actually yielded a lot of really important things in medicine. One of the things that it sort of yielded was intrinsic factor, which helps us obviously, you know, absorb B12 and so there are a lot of great things that came from this, but one of the lesser known things is BPC 157. This is a protein which is naturally secreted, actually a large protein, which is naturally secreted in the human gastric juice to improve mucosal protective properties. So this helps prevent ulcers in your actual stomach. It helps increase sphincter pressures so you don't have acid reflux. And then it also improves mucosal integrity in the intestines to prevent things like leaky gut, Crohn's, and just general gut inflammation. And so this is a really, really exciting one that has hasn't had a lot of human clinical data to date. It's now up to phase 2 clinical trials in humans for ulcerative colitis and Crohn's, but has a lot of different effects. Generally, I always like to mention Ben Greenfield during talking about BPC because if you were to type BPC into Google, his articles are some of the first thing that come up, and he's really popularized this in the biohacking field for repair and recovery. This goes into a little bit of his particular experience with it, where he shows reduced gut inflammation prior to some of his endurance exercise. He had reduced tendonitis in golfer's elbow as a result of BPC, and was able to heal a torn upper hamstring really, really quickly, all with just this one product. And I think that this is going to be similar to the stories that you might hear if you use this in clinical practice. You know, the BPC 157 has a lot of different mechanisms of action. It's one of the most pleiotropic products we have and can help with a lot of different things. But generally, if you look sort of at the overall mechanism and overall sort of organism qualities, one of the things we see is just reduced pain, improved healing, and less inflammation all over. And so I think that this is always a good way to sort of view it. And this is generally how your patients will also know about it or see it if they were to type it into Google. And so I always like to mention that as well. But in order to really talk about the science and the philosophy sort of behind BPC's healing power, I think it's important to go over sort of the phases of healing in the body. Generally, this wound healing is broken down into 3 phases. One is the inflammatory phase. This is where you have high inflammation, your blood clots in order to develop protective covering to these wounds. And then with that inflammation, you get the recruitment of a lot of other mediators. You recruit monocytes, you increase blood flow, you attract immune cells to prevent infection. Then you proceed to the proliferative phase. This lasts a much longer time, unlike the 4 to 6 days of the inflammatory phase. And this really is focused on creating granulation tissue, essentially creating type 3 collagen, using reticulin, sort of organizing all these fibers to create the infrastructure to rebuild and proceed to the maturation phase. In the maturation phase, this is the longest of all the phases, and this is where type 3 collagen is converted to type 1 collagen, and really the infrastructure is not just covered, but you're strengthening and repairing all of the infrastructure which is found in normal cells. And so this is traditionally the phase, and what we were going to go through here is to show you that BPC can help with every phase in a little bit of a different way. So just to center into this a little bit more, right here at phase 1, we have the inflammatory phase. This is the body's initial response, which happens around 4 to 6 days. And this is when, you know, blood vessels initially constrict, form a clot, and then you attract a lot of different cells. This is also associated with things like, you know, pain, swelling, and heat. And generally will happen very, very quickly. The types of cells you recruit here are generally neutrophils to eat up the debris and bacteria. You have macrophage cells, which can also help recruit other cells. And then lastly, you start to see the fibroblasts come in, which proceeds to sort of phase 2. This is the proliferative and repair phase. And so this is where you tend to rebuild some of these products, and it's usually associated with things like increasing angiogenesis and recruiting blood flow. And this is generally where type 3 collagen is deposited. And this is really one of the biggest areas for BPC. BPC has a lot of different effects on this repair and recovery phase. One of the ways it does is by organizing all of these fibers. As we talk about type 3 collagen, collagen itself is actually stronger than steel head to head. And that's a easy statistic. And the reason it does that is because it sort of aligns everything perpendicular, or I should say parallel in creation, to really provide a lot of strength to this target. And that's what's happening in this proliferative phase. And BPC increases the ability for granulation tissue to create and deposit these types of fibers in a very, very speedy way. It also can reduce the inflammation phase and reduce that inflammation, that hot swelling, which allows these granulation tissues to proceed to phase 2 and 3 a little bit quicker. And one of the other things about BPC is it also is very, very angiogenic. It can upregulate nitric oxide production, similarly to things like PDE5 inhibitors. And then this last phase is its maturation phase. And this is where BPC also has a great effect. And this is where it sort of remodels a lot of this collagen from type 3 to type 1, which is a stronger version. And it sort of clears out a lot of these cells through programmed cell death, much like Dr. Rice was just mentioning with some of those senolytic cells which don't undergo the cell death. And so this actually happens around 21 days and can proceed for more than a year. But it still is one of the most important phases because it lasts so long and contributes to really good functioning of wound healing. And so at the very end of the day, we see a ton of different studies in animal models showing the BPC's ability to heal. We've seen some amazing things like tendon to bone healing of Achilles tendon injuries. Most of the time, tendon to bone healing has to have orthopedic surgery. In the mouse models, they were actually able to heal Achilles tendons back to bone with no surgery. And all the fibers which were created tend to be better organized, and the time period for healing was much reduced from those mice that didn't use the BPC. In addition to that, we see reduction of pain. We see reduction of pain in muscle sprains, tears, and damage. We see it help with skin burns. One of the biggest applications of BPC in this integrative catch play medicine space is actually using BPC to help repair CO2 laser injuries and to sort of increase the amount of time that people can do these procedures in office because it reduces the amount of recovery time that patients have to undergo, especially if they're trying to avoid sun and being out in public. The BPC can really shorten that time. We see that it protects organs and prevents ulcers of the stomach. This makes sense because this was originally what it was meant to do. But we also see this in regards to gastric reflux and ulcers in the stomach. Patients who use this even for just a few days can see their symptoms of gastric reflux resolve and reduce stomach pain. We also know it relieves inflammation. This is sort of all over the body. We see it in tendinitis, Achilles tendinitis, there's golfers or tennis elbow. We also see that it can promote tendon fibroblasts. It improves digestive function. It's actually, out of looking at things like CCK, neuropeptide Y, it's actually one of the most effective peptides and proteins in the entire body, even studied head-to-head at protecting gastric mucosal integrity and intestinal integrity compared to all of those peptide products. And then beyond that, it can even protect the liver against toxic insults like alcohol and other sort of noxious stimuli. And so it's got a lot of different healing properties, all of which sort of resolve themselves in sort of the classical phenotypes of tendon and ligament repair for anyone who's undergoing any type of surgery or perioperative procedure. It helps with tendinitis, and then beyond that, it can also help a lot with healing wounds like CO2 laser injuries, and then last but not least, also just helping with gut integrity. A lot of people who are familiar with BPC 157 also probably know it for Lyme disease. As the Lyme disease for the past 4 years. We're not really sure why this has such a good effect, but we know that the BPC itself has a direct effect on viral replication. There have been studies published on herpes simplex virus 1 and 2. We know it can reduce pain, as we mentioned, in both acute and chronic inflammation stages, and that might be why it has an effect with chronic fatigue or fibromyalgia. And generally, we know that it can help with a lot of other things too. It can improve insulin sensitivity with diabetics in mouse models. It can help with leaky gut, and obviously, as we mentioned, it can repair tendons and ligaments. And as I mentioned, the mechanism of action is sort of multifactorial. It has a lot of different effects. A lot of the effects, for instance, on serotonin and the brain effects can be mitigated via its effect in the stomach and the intestines. But it also can help increase a lot of different signalers, both in fibroblasts, in VEGF, and fibroblast growth factors, and reducing things like TGF-beta. And so it has a lot of different effects, but clinically manifest in all the ways we've already discussed. These are also some of the growth factors that it helps increase. It can help increase insulin-derived growth factor, PDG factor, TGF-beta, as I already mentioned, and several others. One other thing that I really like to mention as well is that it pairs really, really well with anyone who's on any type of growth hormone secretagogue. If you're on Samoralin or you're doing growth hormone even itself, one of the mechanisms it has is by increasing growth hormone receptors on tendons and fibroblasts. And so this allows sort of a combination strategy to help repair from tendon and ligament damage by dosing growth hormone and BPC together for an additive effect. Here we also talk about some of the ways that it can help increase the fibroblast effect, and that is by increasing reticulin, increasing collagen, and increasing some of these fibroblasts, all versus control in a better way. And this makes for a faster healing process, but also a healing process which is better organized. So you actually have better, essentially, cellular structure to sort of increase the healing process. And all of these studies I should mention have been done in oral routes with BPC, subcutaneous routes, and peritoneal, and they all seem to have the exact same efficacy. And so if you're worried about converting from a subcutaneous injection to an oral product, you really don't need to worry. They've all been documented to have a positive effect. One of the other things that I always like to talk about, because I think it's very underutilized but extremely profound in effect, is its ability, the BPC's ability to help patients with any type of indigestion or gastric reflux. You know, PPIs have unfortunately had a lot more evidence come out lately about their negative effects, even causing things like premature death, increased risk of cancer, and several other unfortunate events. And so the BPC 157 is a great way to convert those patients who are already on PPIs or taking a ton of Tums in order to help fix some of their symptoms. And beyond that, it doesn't just control the symptomology, it also fixes the underlying causes. There's several studies which look at sphincter pressure, particularly with things like hiatal sphincters, to show that you're actually reversing the problem and making sure that the gastric reflux is no longer happening. And that's in addition to protecting against ulcers and all of the intestinal effects which it has as well. And so if you have a patient who's on PPIs, this is a sort of a no-brainer conversion to help the patient and reduce the negative side effects of these PPIs. This just generally talks a little bit about some of its targets. You know, the BPC is so effective in so many different conditions, it's hard to narrow it down. A lot of times I have people say, hey, which one should I use acutely? Should I use things like the BPC 157 or the thymosin beta 4? And really, I think the answer is BPC 157 is always pretty applicable. It's been studied to be effective in reducing inflammation in acute settings and reducing pain, but it's also been studied to help with even the inflammation and that chronic sterile low-grade inflammation that happens as a result of some of those secretory associated phenotypes. And so really it's great for all conditions. Generally, if I were going to limit it a little bit more, I would generally say that the BPC 157 is really great for tendons and ligaments. And even though it aids in soft tissue repair, usually the thymosin beta 4 is a little bit better than that at that time. So this is another one that most all of your athletes are going to like, both for acute and chronic injuries like the tendonitis. It's one that anyone who is experiencing any type of nagging injury should definitely consider, but it's also something that people who are recovering from surgery and other types of procedures should consider implementing as well. And so just as a quick summary, these are all the different ways in different areas where BPC can be used. You know, it's got implications in aging, asthma, reducing mast cell release. It's got obviously effects in the GI system, as we've talked about. It's even been studied in periodontitis with inflammation in the gums. And so it can really affect all of these different areas with really, really great effects. One of the ones that I briefly mentioned, that one I really want to reiterate again, is depression and anxiety. Obviously, by fixing that GI system and sort of helping correct the gut-brain axis, you can even affect the neurotransmitters in the brain like serotonin, and this has been shown in several studies as well. And then also I want to mention TBI. Its effect on reducing things like NF-kappa beta and some of those inflammatory markers are great even in some of those settings as well. And so these are all the different ways it can have an effect, and now that it's available sort of as a supplement, it's extremely much less expensive. Traditionally, this was offered for around 150 in a lot of compounding pharmacies, and now through the BioT supplement platform, you can get it for right around 50. And so this is really a third of the cost of what it once was, and has so many different applications. I'm sure it will be a staple of all of your clinics. And so just to make it extremely, extremely simple, I would traditionally tell people that if you're really wondering about how you should take all this information about BPC, a lot of complex, almost vague information due to its multiple mechanisms of action, where do you actually put the tires to the road? And I think that the three biggest things that are going to come from this are going to be tendon and ligament injuries. If there's one way you can make sure the BPC is absolutely making a difference, I highly recommend using it for anyone who's experiencing tendonitis or some type of ACL, MCL tear, or Achilles tendon tear, the BPC is extremely effective at reducing pain and increasing remodeling. And for those of you who have patients like this and are still a little bit skeptical, I definitely encourage you to look at some of the before and afters of these mice who have undergone the tendon to bone rehealing, and just how quickly that is happening. It is, as I mentioned, increasing that type 1 collagen, which is helping in both that phase 1 and phase 2 of that recovery phase and wound healings as well, which is why it's so effective at helping repair from CO2 laser injuries too. The second one is those gut and digestion problems. As I mentioned, it's human clinical data. Mostly has gone to phase 2, now in phase 3 clinical trials for ulcerative colitis. By reducing that inflammation in the gut, sort of helping increase those tight junctions, and then obviously just having its effect on being a sort of a bioregulator. It can help with Crohn's, ulcerative colitis, IBD, and anyone who's on a proton pump inhibitor, this is a no-brainer for. One thing I should mention about both of these issues is that generally tendon and ligament injuries will benefit from the BPC in a little bit of a faster timeline. Traditionally, you only need 1 week or 2 weeks to see the benefits of BPC in some of these acute injuries, but GI problems can take a little bit longer to take effect. Sometimes they take 4 to 6 weeks, but the effects are still, I would say, promising and generally consistent across the board, and would highly recommend this product for any of those conditions. And so in summary, this is the BPC is great for any type of inflammation and healing. This right here talks about some of this inflammation, which is sort of a crossover from what Dr. Rice was mentioning as well. Reducing that inflammation can reduce all of the negative factors that are associated with senescence as we age. But beyond that, anybody who's experiencing healing or gut issues, the BPC is really a no-brainer for. One of the things I didn't mention earlier is that in all the clinical trial, it actually has no side effects and less side effects than placebo. And so it's extremely, extremely safe and really a no-brainer to add to some of these regimens. And again, this can be taken via oral capsule administration. Generally, it's done at around 500 micrograms daily. It's been effective at 10 micrograms per kilogram and even 5 micrograms per kilogram. And so extremely low doses of this can have still huge effects. A lot of people actually even will end up titrating from 500 micrograms down to 250 micrograms for GI effects after they experience the desired result. You might even see some case studies out there of particularly there's a young man who experienced just a sort of a life-changing event with Crohn's and ulcerative colitis, and it lost over 90 pounds in just 3 months. Started the BPC and was able to sort of regain a lot of his life back. That's some of the effects that we're talking about with BPC. They can have both on the GI and just general body. And so this is a great product to take 1 capsule or 2 capsules a day to help with any of those states. And even if you have athletes, this is something they can stay on full time in order to help performance and help regeneration. And I know we went through that quick as well. I know that we're following both a very dense lecture on things like the senolytics and the NMN and NAD. But this product, just think of BPC 157 exactly as its name it suggests. It is a body protection compound that sort of decreases inflammation, helps repair wounds and muscle tissue, and as well as ligaments, and improves gut-related issues, whether that be leaky gut or even gastric reflux. And so it really protects the body as sort of a homeostasis promoting product in all different types of body systems, and really is applicable for just about everyone with no contraindications because it has less side effects than placebo. And so if you really want to heal like Wolverine, this is definitely a product I would put on your list, and will probably be one of the most used products I would say in the BioT supplement line, just because of how helpful it is in so many